Understanding Mental Health and Distress. I'm Nathan Loynes, and this material was prepared in 2023. Our aims are to begin to disentangle some of the complexity of mental health, illness, and distress, to explore where our notions of mental health may come from, and to explore how these complexities and contradictions continue to shape our individual and broader societal responses towards those with mental health needs. The material comes from Coppock and Dunn's chapter, Understanding Mental Health and Distress, from their 2010 book, Understanding Social Work Practice in Mental Health. And the material is paraphrased from pages 5 to 22. First of all, we've got to appreciate that mental health and mental distress are complex subjects. They are not easy to grapple with. Mental health and mental distress continue to constitute intricate subjects characterized by a rich tapestry of terminology, concepts, and theories. And to grasp these complexities, it is imperative for practitioners to recognize the diverse and sometimes conflicting or contradictory nature of language, ideas, and explanations that have evolved in this field over time. The understanding of mental health and mental distress has been shaped by two principal influences: popular culture and the professional discourses. Professional discourses are the things that are said, written, and produced within those professions that have worked with mental health over the years. These influences interact in intricate ways, resulting in a blend of common sense and scientific knowledge that can be challenging to disentangle. Therefore, it is essential to critically analyse the interplay between lay and professional knowledge to grasp the foundation of contemporary mental health practice. Lay attitudes towards individuals experiencing mental distress often reveal a lack of understanding and knowledge. Public surveys constantly demonstrate confusion regarding the nature of mental distress. Disagreements among academics and professionals are prevalent when it comes to defining and comprehending mental health and mental distress, as we'll see. And achieving a single or unified definition of mental health and illness remains a challenging endeavour which is yet to be solved, if indeed it could be solved. Definitions of mental health vary, encompassing both negative perspectives, such as the absence of a diagnosable disease, and positive perspectives that describe it as a state of well-being. For our purposes, we'll use the term mental health as a cover-all term, an umbrella term, which encompasses both mental illness, mental distress, stress, and the more positive theories about mental well-being. The choice of terms used often aligns with specific philosophical and theoretical perspectives. For example, traditional psychological and psychiatric literature commonly employs mental illness and mental disorder, and this aligns with the psychomedical paradigm, the medical model. In contrast, critical social scientific and user-centric literature tends to prefer mental health problem or mental distress, reflecting a psychosocial paradigm with its roots in the social perspective of health. Coppock and Dunn point out a point for reflection for those that are working with people that are experiencing mental distress. To navigate this complex field effectively, practitioners must acknowledge and reflect upon their own feelings, attitudes, and understanding of mental health and mental distress. Neil Thompson's PCS model is a valuable tool for practitioners in helping them understand how wider social influences, popular culture, and personal attitudes interrelate. Mental health is all around us and within us too. Health and social care practitioners are not immune to the impact of cultural influences, which can shape our ideas and behaviours. Recognising this reality is the initial step towards becoming a critically self-aware practitioner, capable of identifying and addressing any personal biases and discriminatory practices that we may have. The public's attitude towards mental health and distress is conflicting. Surveys conducted by the UK Department of Health have consistently highlighted complex and sometimes contradictory attitudes towards mental distress. Notably, individuals often express sympathy and concern for those experiencing mental distress, while at the same time concurrently endorsing actions that perpetuate stigma and exclusion. Although mental health is all around us, we still try to distance ourselves from it, or rather, those people that are suffering from mental distress. Despite the prevalence of mental distress within our society, there is a prevalent or dominant inclination or tendency to distance ourselves from it. And it's driven by fear and social norms and taboos. This underscores the existence of a deep-rooted fear or prohibition against mental distress in contemporary society. Throughout history, we can see that the social exclusion of the mentally distressed is nothing new. Historical and cross-cultural evidence attests to the historical exclusion and the fear that we have of individuals experiencing mental distress. Even with deinstitutionalization and the official integration of those with mental distress into communities, care in the communities, these individuals often occupy a token position within society, facing enduring alienation and exclusion. There'd be a tendency to assume that today is better than yesterday and that attitudes are improving towards mental health, given as much as we see of it in the media and elsewhere. However, recent evidence suggests a potential worsening of public attitudes towards mental distress, revealing the influence of powerful ideological forces. These attitudes, resistant to progressive social and political developments aimed at improving the lives of individuals experiencing mental distress, pose challenges to addressing mental health issues in society. In other words, some of the more negative attitudes and behaviours that we hold are so ingrained that even policy changes and demystification of mental health and illness is still a difficult task. The fear that we have is deeper than just a perception of being negatively judged by others and being seen to be mad or weird or eccentric or whatever disparaging term we might use. There's a contemporary reluctance to admit to experiencing mental health problems, and it's solely not rooted in an existential fear or a day-to-day fear of being seen as being the other or different. It's equally related to the material consequences, the actual consequences of exposing oneself as being suffering from mental distress. And these material consequences include inequality, discrimination, and oppression. Quite simply, it limits one's opportunities one has to exercise rights and power within society, whether that's access to healthcare or access to other things, other types of life chances. So let's revisit our aims that we saw at the start of this. Mental health is a complex topic, and we have only just begun to disentangle some of the complexity of mental health, illness, and distress. We're choosing to use the coverall term mental health to cover both positive mental health and more negative elements of an individual's mental health, illness, and distress. We've begun to explore some of the influences of where our notions of mental health may come from. Predominantly what professionals have said over the years, that's the professional discourses, and also what popular culture how popular culture has represented mental health, and lay opinions, how neighbours talk to each other about those that might be experiencing mental distress. And we've explored how some of these complexities and contradictions continue to shape our individual and broader societal responses towards those with mental health needs. And a word of warning is not to assume that each day things get better and things improve. As stated earlier, the references that I've drawn upon in this are Coppock and Dunn's 2010 chapter, Understanding Mental Health and Mental Distress, which is available in their book, Understanding Social Work Practice in Mental Health, published by Sage in Los Angeles, and it's paraphrased from pages 5 to 22.